How's it going, folks? You guys hear me okay? All right. Happy Monday. I hope everybody had a good weekend and is ready for the new week. Guys, we have a very important lab today, right? So today we are covering two labs, labs 4 and lab 5. And lab 5, we are going to discuss half of the first lab exam. Remember, the first lab exam is going to cover the skeletal system and is going to cover skeletal muscle. Okay. And today we're going to go over half of that. We're going to cover the skeletal system today. We're going to go over and talk about the name of different bones. We're going to talk about the bone markings. And I'm going to give you guys a ton of clues on what you should expect for the lab exam. Hopefully all of you started to study for the exam. I know that I mentioned this every class, but I'm going to keep on saying it because it is that important. You need to start studying for that exam that is coming up pretty soon. Okay. And I need you guys full focus today. And if you have any questions, nobody ever asks any questions, but if you do have any questions, now that you have your exam list in front of you, ask the question because I guarantee you, you're not the only one that probably has that question. Okay? Don't be scared. Don't be afraid. It is important. It is important that you ask questions so that I know if you understand or not. Can we do that?
Where's the exam list?
The exam list you can find under the important resources in Lamaku. Any other questions, guys? All right. Now, I'm going to go over lab 4 real quick. I'm going to speed through it because the stuff that we have already discussed in the lecture, and this is not something that's going to be on the lab exam. So I'm going to go really quick through it so that we can get to the most important part, which is talking about naming of bones and bone markings. So let me share my screen with you. Can everybody see my screen okay? Okay, folks. So let's go over lab 4. And lab 4 discusses about tissue growth anatomy and histology. So we're going to spend again a little bit of time talking about the types of tissues, classification of epithelial tissue, types of connective tissue, which we have 6 different types, a little about the muscular and nervous tissue. Okay, so what are the 4 different types of tissues that we have in the body and which is going to make every single organ instruction in our body? We have what we call the epithelial tissue, connective, muscular, and nervous. The epithelial tissue is the tissue that covers our entire body, not only on the outside, but also inside of our body, right? And we also know from the lecture that the epithelial tissue is avascular. It doesn't have any blood vessels running through the tissue. So when we look at our skin, folks, the surface of the skin, a very thin layer on top of the skin here, this is made of epithelial tissue. Now, this epithelial tissue can be classified based on the shape of the cell and also based on the number of layers of cells on top of each other. If the cell looks like a flat pancake, is what we call the squamous. If it looks like a little cube, is called cuboidal. If it looks like a little column, it's called columnar. If it is a single layer of cell covering that tissue, we're going to call that simple. If it is several layers on top of each other, we're going to call that stratified. And then we have a special type called the pseudo stratified. Pseudo means not really, kind of fake. Okay, so it's a fake stratified. Because as we can see right here, these are all columnar cells that have a different sizes of column. Some of them are short, some of them are long, and everything in between. So it looks like there's several layers, but it's actually one single layer. Okay, so how would we name this then? When we look at this tissue, combining the cell shape with the number of layers, we would call this one, for example, simple cuboidal. We would call this pseudostratified columnar. This would be stratified cuboidal, and so forth. All right. Connective tissue is a type of the tissue that will connect and bind our organs and keep everything nicely in together. And the connective tissues, and we have 6 different types, they share a couple of things among them. One of the things that they share, the 6 different connective tissues, is the fact that we're going to find this very special cell called the fibroblast. And this fibroblast, again, is found several different types of connective tissues, and they make several different important proteins and extracellular matrix material. Okay. Now, what are the 6 different types of connective tissue? We have a bone, we have a cartilage, we have tendons, we have adipose, areolar, and we have blood. So 6 different types. And again, every single one of them is slightly different, and they are made of different cells and different extracellular material. Okay. Now, for the muscular tissue, we know that we have 3 different types. We have what we call the skeletal muscle, which, by the way, this is what is going to be on the first exam. Okay, we're not going to talk about the cardiac muscle or smooth muscle in that first exam. It's just the skeletal system, bones, and the skeletal muscle, naming the bones, naming bone markings, and naming muscles. Now we know that out of the 3, only the skeletal muscle is voluntary. We can control with our brain. The other 2 are involuntary. And both the skeletal and the cardiac muscle, they have what is called the striations, which are structures that help with cell-to-cell communication. We don't see striations in the smooth muscle. Now, the only thing you need to know at this moment about the nervous tissue is that nervous tissue are made mostly, not only, but mostly of a type of cell called a neuron. Do not confuse the cell, the neuron, with the tissue. The tissue is called the nervous. The cell that is most abundant in the nervous tissue is the neuron. Okay. All right. That is it for lab 4. And by the way, there is no in-lab activity for lab 4. All the in-lab activities, they're going to be for lab 5. Okay. But they're going to count for both lab 4 and lab 5. But they're all going to be on lab 5, all as puzzle videos walking you through a model of the skeletal system in humans. All right. So lab 5 discusses about the integumentary system and also the skeletal system. Once again, I'm going to go very quickly through the skin and integumentary system so we can focus on the skeletal. We do know that we have 3 different layers of skin, right? We have a thick layer in the middle called the dermis. And then on top of the dermis, we have the epidermis and the hypodermis. When we take a look at the epidermis, we're going to find several layers. Again, just the epidermis. And we find these layers, most of them all over the body, but there's 2 places in which we're going to find one extra layer, which is in the palms of our hands and the sole of our feet. We're going to find this extra layer here that is called the stratum lucidum. So in the palms of our hands and the sole of our feet, we have 5 layers, all 5 right here. And then in the rest of the body, we're only going to have four. Only the stratum corneum, granulosum, spinosum, and the stratum basal. Okay. Now, the epidermis is avascular. And as I mentioned, we have throughout the body, we have a thin layer versus a thick skin layer. The thin layer is only made of four different layers, the thin skin, and the thick skin is made of five, which includes the stratum lucidum. Moving on, let's talk about the accessory structures of the skin. And we know that within the skin, we're going to find the cutaneous glands, we're going to find the hair follicles, we're going to find the nail. These are all accessory structures to the skin. And among the cutaneous glands that we find embedded in the skin, there are two different types. We have the sebaceous and we have the sudoriferous. The sebaceous, they produce oil, they produce sebum, right? And the sebum helps to lubricate our skin, to create a layer of oil on our skin to prevent desiccation of the skin, prevent the skin from losing water. The sudoriferous glands, they produce sweat, and the sweat is important to maintain our body temperature. And also sweat helps to inhibit the growth of bacteria because it is a hypertonic environment. Taking a look at the hair, also called the pili, and the hair is made of different structures. There's different anatomy of the hair. The section of the hair that is poking outside of the skin, that's what we call the hair shaft. And then we also have a root, and all the way at the bottom, we have a hair bulb. Okay. Within this hair bulb, we're going to find a layer of cells called the hair matrix. And within the hair matrix, we're going to find stem cells. And those stem cells, they divide very fast and they allow the hair to grow from the bulb towards the tip of the hair. Every single hair in our body has a tiny little smooth muscle called the erector pili that is involved with our sensation of goosebump or chicken skin, as we call it in Hawaii, when you are scared of something. And finally, the nails are also divided into different sections. The section of the nail that extends beyond the fingertip is what we call the free edge of the nail. The main section of the nail is the nail body. And then at the bottom of the nail body, there is a little white section called the lunula, and a section that we don't see, which is the nail roots, and the little piece of skin that helps to anchor the nail to our finger, and that is what we call the eponychium or the cuticle, okay? Right here in the nail roots, we're going to find another layer of stem cells, which we call the nail matrix. And again, it's the division of the cells that allows our nails to grow from the roots towards the tip. All right, folks. So if you're sleeping up to this point, now is a very good time to wake up. I will help you prepare for half of the exam today and the other half of the exam next week, Monday. Okay? Now let's take a look at the skeletal system. And just by looking at this little cartoon here, folks, we can tell that we have a variety of different bones. Not all bones are created the same. We have different sizes, different densities, different functions of bones. Okay? And we can classify bones based on their size as long bones, like the femur, the humerus, the tibia. We can classify them as flat bones, like the bones of the skull, like the bones of the sternum and the ribs. We can classify them as short, like the bones of the hands and the foot, the carpals and the tarsals. And we can classify them as irregular, like the bones that we find in our vertebral column, okay? And also the bones of the hip. They have a weird shape to them. They are very irregular. Now, we can also take the entire skeletal system and subdivide the skeletal system into two major groups of bones. And we're going to use this subdivision to help us study, to help us remember and memorize the name of these bones. Now, within the skeletal system, we don't find just bones. Besides bones, we also have cartilage, we have joints, and we have ligaments. Can anybody tell me where do we find the ligaments in the skeletal system, folks? What do ligaments do? What is the function of a ligament? Anybody?
They attach bone to bone.
Absolutely. They attach bone to bone at a joint. And that is different from a tendon, and tendons attach muscle to bone. Okay, keeping the skeletal muscle attached to the skeletal system. So the subdivision of the skeletal system are what we call the axial skeleton and the appendicular skeleton. Now we can take a closer look at this skeletal division right here. Let's see what are the bones that belong to the axial skeleton. Let's see what are the bones that belong to the appendicular skeleton. So starting with the axial skeleton is made of the skull. And within the skull, we have the cranium bones, and there are several of them, which we're going to talk about today. And we have what we call the facial bones, which are there also several of them. Then moving inferiorly, we're going to find the thoracic cage, and the thoracic cage is made of the sternum and the ribs. And then we have the vertebral column, and the vertebral column includes the vertebra. So each one of those bones is a vertebra. And then all the way at the bottom, we're going to find what we call the sacrum with a coccyx at the end. Okay, they all belong to what we call the vertebral column. Now, what about the appendicular skeleton? The appendicular skeleton, they are attached, excuse me, to the axial skeleton. Is starting in the superior aspect, we're going to find what we call the pectoral girdle, also called the shoulder girdle. And the shoulder girdle includes two bones. It includes the clavicle and includes the scapula, which we're going to go over each one of them. Moving down now into the upper limbs, we're going to find the humerus. And there's nothing funny about the humerus, but that's the name. And then in the lower, what we call the forearm, we're going to find the two bones parallel to each other. And those are what we call the radius and the ulna. Can anybody tell me which one has a more medial aspect out of this shoe here?
The ulna.
The ulna, absolutely. Why is it medial? It is medial because it is closer to the midline of the body. Okay, so the ulna is medial in relation to the radius, and the radius would be lateral in relation to the ulna. Now, moving down, we have the carpal bones, and the carpal bones are the bones of our wrist. Then we have the metacarpal bones, and the metacarpal bones are the bones of the palms of our hands. And then we have what we call the phalanges, which are the bones of our fingers. And we're going to go over each one of them. Now, the good news is that the arrangement of the carpals, the metacarpals, and the phalanges are very similar to the arrangement of the tarsos, metatarsals, and phalanges of our foot. And we're going to get to that. All right, so now we are at the what we call the pelvic girdle, also called the hip girdle. And the pelvic girdle includes what we call the hip bones. And we're going to talk more about the hip bones, what they are. Moving down now into the lower limbs, and we have the biggest, longest bone that we have in our body, which is the femur. Then we have a bone that is protecting our knee joint, which is called the patella. And then in the lower leg, we have a similar situation as with the forearm. We're going to find the two bones parallel to each other. And those are the tibia and the fibula. Okay. And we can see that the tibia has a medial aspect, while the fibula has a lateral aspect. And then moving to the foot, we're going to find the bones of the ankle, which are the tarsals, and the bones of the sole of our feet, which are called the metatarsals, and our toes. The bones of our toes are called the phalanges as well. Do not confuse carpals with tarsals. Do not confuse metacarpals with metatarsals. Is only one letter difference here, but it makes all the difference. We need it to be precise, okay? Now, if you have taken a look at the exam list, and I know that some people haven't yet because you don't even know where the exam list is, but if you have taken a look at the exam list, you have seen that for the bones, the skeletal system is not just to memorize the name of bones. There are also what we call bone markings that you need to know. And we're going to go over those here together today. Now, what are these bone markings? Folks, bone markings are specific features on a bone. It could be a hole through a bone. It could be a channel through a bone. It could be a bump on a bone. Okay? These are all markings. They have a specific function. They serve as a passage of nerves. They serve as a passage of blood vessels. They serve as attachments for ligaments and tendons. That's what a bone marking is. And every bone in our body, they have markings. And there are a few markings that you guys need to know for the exam that are included in the exam list. If it is not in the exam list, you don't need to know. The exam list is your study guide. Now, if it is in this exam list, you are responsible for it. Now, let me give you just an idea of what some of the markings are. Now, we're going to take a look at the skull right here, but keeping in mind that we don't find markings just in the skull. Again, we find markings all over the skeletal system. Okay? Now, in some of the bones, we're going to find what we call, for example, a groove. What is a groove? A groove is a furrow on a bone, like an indentation on a bone that allows blood vessel and nerves to run right next to it. For example, we have a groove on our mandible, which is, again, an indentation, a little channel that helps with the attachment of blood vessels and tendons, okay? They run right next to it. We also find what we call a fissure. What is a fissure? A fissure is a narrow, slit-like opening through a bone. And we have a very important fissure right here, actually, a couple of them inside the orbital space. We have at the bottom here what we call the inferior orbital fissure. And then over here we have the superior orbital fissure. So a fissure, it's narrow, slit-like, kind of like this. Now, what do you think is going to pass through the orbital fissures, folks? Blood vessels and the optic nerve, going from our eyeball, sending information to the brain in what we call the visual cortex of the brain. Now, not only are we going to find the narrow slit-like openings through a bone, but we can also find round or oval openings through a bone. And that's what we call a foramen. Foramen is plural, foramina is singular. Okay, so what is the difference between a fissure and a foramen? Fissures are slit-like, they are narrow. Foramens are oval or round, opening through a bone. Now, we're also going to find notches on bone that are indentations at the edge of a bone that helps with articulation with other bones. We have a meatus, which is a canal-like passageway. So different from a foramen. A foramen is just the surface hole, okay? If it is not a hole, but actually a channel through a bone like this, folks. Now we're going to call this a meatus. For example, we have the internal acoustic meatus, which is a channel that allows for our hearing nerves to pass right through it. We also find what we call a sinus, and sinus, we only find them in our skull, and these are cavities within a bone filled with air and covered with a mucous membrane. And there's also a fossa, which are shallow basin-like depression on a bone. Okay, again, just some definition of a general type of bone markings, but we're going to go specifically into the ones you need to know. So guys, let's start naming bones, and we're going to start at our foot. And remember, the skull is made of two different types of bones, right? We have the facial bones and we have the cranium bones. Let's start with the cranium bones first. Right here in the front of our forehead, we have one big plate of bone. This is what we call the frontal bone. It is one huge plate of bone. There's only one, a single one. Now, as we move from anterior towards posterior, on the top of the head, we're going to find another two bones called the parietal bones. And these are actually, there are two of them. And I have a slide included in the presentation that's going to give you a presentation. It's going to show you what bones are single, what bones are double. Why do we need to know that? Folks, I'm going to say it. I already said this before. I'm going to say it again. I still see people making this mistake in the quizzes. Every time you have a bilateral structure, you need to say if you're pointing to the right or the left. You don't need to be asked in the exam questions or the quiz questions. If it is bilateral, you need to include right and left. Okay, so for the frontal bone right here, if today was the exam and I was pointing to this bone right here, all you have to answer on the exam is frontal. You don't even need to add bone into it. If you add, it's fine too. But there is no right and left for the frontal because the frontal is one single plate of bone. Now, if I was pointing to this one here on the exam, this would be the right parietal. Again, you need to give the name of if it is the right or the left. Okay, every time that is a bilateral structure. Moving all the way to the back of the skull, we're going to find what we call the occipital bone. And this occipital bone, like the frontal, is only one big plate of bone, which with several markings on it. We're going to talk more about it in a minute. Then we have the temporal bone. As we can imagine, there are two temporals, right? We have the right temporal, we have the left temporal. And for the temporal, there are several important markings that I love asking questions on the lab exams. One of those markings is a bridge that is connecting the temporal bone with the zygomatic bone, which is our cheekbone right here. If you put your finger right here to the side, guys, you're touching what we call the zygomatic bone. And of course, they're also bilateral. We have the right, we have the left. Now, the bridge that is connecting the temporal with the zygomatic is a marking of the temporal bone. And that marking is what we call the zygomatic process. The zygomatic process. Again, take your finger, put to the side of your face right here, folks. You are touching the zygomatic process of the temporal bone. So let's practice together. Everybody's attention here. Let's say today was the day of the exam. And I am pointing to this marking right here. How would we name this to answer this question in the exam to get full points for the question? You would say zygomatic process, right temporal. So you gave me the name of the bone marking, and then you told me what is the bone that the marking belongs to. This marking that I'm pointing to belongs to the right temporal. What if it was the other side? There would be a zygomatic process, left temporal. Okay, this is how you answer questions related to the bone markings. What if you just tell me on the exam, oh, this is the zygomatic process? You will have partial points for the question. What if instead of answering the name of the bone marking, you just say the name of the bone itself? You're going to get 0 points for the question. Because the main question here was regarding the marking. If you just answer the marking, you get partial points. If you just give me the name of the bone, you're going to get 0 points. To get full points, you need to tell me the name of the marking and the bone that the marking belongs to. Let's try a few more here, folks. We have another marking here called the external auditory meatus. This is a marking of the temporal. If I was pointing to this marking here on the exam, you would say external auditory meatus, right temporal. Another marking right here of the temporal called the styloid process. So that would be styloid process, right temporal. Is that clear, folks? Any questions about that so far? Nothing. All right. Moving on then. Now let's talk about some of the facial bones. And I already talked about one of them, which is the zygomatic bone, and it is bilateral. Please don't confuse zygomatic bone with the zygomatic process of the temporal. 2 different things. The zygomatic bone is a bone on its own. The zygomatic process is a marking of the temporal. Okay? Then, and we're going to see this in a better view, but we also have what we call the sphenoid bone. We can see a little bit of the sphenoid bone right here. There's an important bone on the sphenoid that I want you guys to know. I'm going to talk about it in a little bit. And then inside of the orbital space, and the orbital space is where our eyeballs sit, we're going to find the ethmoid bone and also the lacrimal bone. All the way at the top of our nose, we're going to find the nasal bone. And then in the front of our mouth right here, on the top of the mouth, we're going to find what we call the maxilla. Do not confuse the maxilla with the mandible. A lot of students do that in the exams. We actually going to see the maxilla. There are 2 of them. There's a line in the middle separating the right maxilla from the left maxilla, but the mandible is just one bone, one big plate of bone. Okay, and there's a couple of markings on the mandible that I want you guys to know. One of them is what we call the mental foramen. And what is the mental foramen? The mental foramen is this little hole, this little oval hole that we have right here, and there are 2 of them on our mandible. Okay? Now, I want you guys to practice with me. Let's say today is the exam, and I'm pointing to this bone marking right here. Go ahead and name it for me. You're mute, sir. Name the marking for me, guys.
Mental foramina, right side mandible.
Okay, we can simplify that. Now here, it matters where we put the right. Now we're going to say it is the right mental foramen of the mandible. Okay, why? Because we only have one mandible. We don't have right mandible and left mandible, like we have right temporal and left temporal. So again, the answer would be right mental foramina is singular, right mental foramina of the temporal, of the mandible. Now, this one right here would be the zygomatic process of the right temporal. Right, you see the difference here? Zygomatic process of the right temporal, right mental foramina of the mandible. Any questions, guys? All right, so now we're still talking about the cranial and the facial bones. Now, what I'm going to do is I'm going to slice the skull open, and I'm going to take the top of the skull and remove it. So now we're looking inside the superior veil with the cranium removed. Okay? So now here we can see a lot better this sella turcica, and the sella turcica is a marking of the sphenoid bone. And guys, the sphenoid bone is this big bone right here, kind of look like a butterfly. Okay, it is just one single plate of bone. And within this the sphenoid, we have a marking. The marking is called sella turcica, which literally means Turkish chair. So it's a little chair within the sphenoid. What is going to sit right in the sella turcica? Does anybody know? The pituitary gland. We have a very, very important gland called the master endocrine gland, which is the pituitary gland that controls many other glands in our body. And the pituitary gland is going to sit right there in that little chair, being protected inside of our skull. So what if I was pointing to this marking right here on the exam? How would you answer that to be correct? You would say sella turcica sphenoid. So it gave me the name of the bone marking and the bone to which the marking belongs to. Okay. Moving on, let's take a look at another marking. Now, this marking here belongs to the temporal bone, and this is what we call the jugular foramina right here. And this jugular foramina, it is an oval hole and is a marking that belongs to the temporal bone. So if I was pointing to this one right here, folks, in the exam, this would be the jugular foramina right temporal. If I was pointing to this one, jugular foramina left temporal. Moving all the way down here, we're going to have our occipital bone, which is the big bone in the base, at the base of the skull. And the occipital bone also has some important markings that I like to ask questions in the exam. And you can't miss that marking. That marking is this huge foramina right here. This is what we call the foramen magnum. What does magnum mean? Magnum means large. Can anybody tell me what do you think is going to pass right through the foramen magnum, folks? Why do we have this big hole right there?
Spinal column.
The spinal cord. The spinal cord is passing right through it, okay, which is an extension of our brain. So again, what if I was pointing to this marking right here on the exam? This would be foramen magnum occipital. Foramen magnum occipital. Another view of the skull, and now I'm going to have the mandible removed. So we have an inferior view with the mandible removed out of the way. So we can see again some of the markings on these bones right here. I want to start all the way here at the top with the maxilla, right? And the maxilla is the bone that we have right here on top of our mouth. And as I mentioned to you earlier, the maxilla is bilateral. We can clearly see there's a line right there separating the right maxilla from the left maxilla. Now, what are we looking at right here, folks, in this cartoon? We are looking inside of the mouth, in the roof of the mouth. And the roof of the mouth is mostly made by the maxilla, but not only. And in the roof of the mouth, there are a couple of markings that I want you guys to know for the exam. And these are what I call the palatine process. If you take your finger and you feel the roof of your mouth, you're going to feel these grooves right there in the roof of the mouth. Now, don't do that right now. Your finger is probably dirty, but you're going to feel them right there, this grooves. Okay. That is the marking of the maxilla, the palatine process of the maxilla. So help me out. Let's practice. I am pointing to this marking right here. Go ahead and name it for me. And guys, this is your chance to help you study for the exam. Don't wait for other people to jump in. Participate. It's okay. It's good. If you're wrong, that's good. I can fix that. I can correct that. Okay. So help me out here. Name this marking right there.
Palatine process of the left maxilla.
Absolutely. That is the palatine process, left maxilla. Okay, so this, be careful with your vil. So this would be the left. This is going to be the right. Excellent. Now, not only we have a maxilla on the roof of the mouth, but we also have another bone called the palatine bone that also makes part of the roof of the mouth, all the way in the back of the roof of the mouth. So don't confuse palatine bone with palatine process of the maxilla. The same way that we have a zygomatic bone and we have a zygomatic process of the temporal. Two different things. Okay. Moving on. Let me focus now right here on the temporal. So we talked about the jugular foramina. And now let me talk about the carotid foramina, which is another bone marking of the temporal. And we are going to have the carotid passing right through this holes right there. And then taking a look at the back of the skull, again at the occipital bone, there's another marking that I want you guys to know. I love asking questions about it in the exam. We already talked about the foramen magnum, right? This big oval hole right here. To the side of the foramen magnum, we are going to find two flat surfaces. One right here, one on the left, the other one on the right. These flat surfaces are markings of the occipital bone that we call occipital condyle. So we're going to find left occipital condyle of the occipital bone, and we have the right occipital condyle of the occipital bone. Okay? Any questions? And finally, now we're taking a look at the anterior view of the cranium. And we can see right here, for example, the frontal bone, how is one big plate of bone covering the entire forehead. And I want to move on and talk about a couple of other bones here that are found within the nasal cavity. One of those bones is what we call the middle nasal concave. And we can see the middle nasal concave right here. There are two of them on the right and on the left. These are markings of the ethmoid bone. So they belong to the ethmoid bone. So if I was pointing to this guy here on the exam, this would be the left middle nasal concave of the ethmoid. The other one would be the right middle nasal concave of the ethmoid. Another bone, a marking that belongs to the ethmoid is what we call the perpendicular plate. And this is the bone that separates our two nasal cavities. They make a wall in between the two nasal cavity, okay, the right nasal cavity and the left nasal cavity. And again, this is a marking of the ethmoid bone. So perpendicular plate of the ethmoid bone. Then we have the inferior nasal conchae. And the inferior nasal conchae, there are two of them. And these are markings of the lacrimal bone. Okay, so these are the inferior nasal conchae of the lacrimal. And then finally, we have the vomer right here, which is another bone on itself. So this is the slide that I mentioned to you earlier, in which you're going to find the list of the 8 cranial bones, the list of 14 facial bones, and if they are single or if they are double. Because again, if they are double, you need to tell me the right from the left. If there's only one of them, you don't need to do that. In fact, if you do it, it's wrong. I'm going to mark you as wrong. Okay? Is anything not clear up to this point, folks? Anything is confusing? All right. Moving on. Let's talk about this bone right here, which is what we call the antisocial bone. Why is it called the antisocial? The hyoid bone is called the antisocial because it does not articulate with any other skull bone. What does articulation mean, folks? Touching. That's what articulation means. When one bone touches another bone and it forms a joint, that's a point of articulation. Okay? The hyoid bone, it sits by itself and it's held in place by long ligaments, which is going to help keep it attached and in place. The function of the hyoid bone is that it serves as a support for our tongue. So our tongue kind of sits right on top of the hyoid bone. You don't need to worry about the markings of the hyoid bone, just to be able to identify it. Moving on, let's talk about the vertebral column. Great news. You don't need to memorize individual name of vertebrae. And you already knew that because you are studying and you see that in the exam list, right? It is a good idea to know the different curvatures of the vertebral column. What do I mean by that? We know that our vertebral column is divided into different sections, what we call the curvatures. So from the first vertebrae, which we call C1, all the way to C7, this bones right here belong to what we call the cervical curvature or the cervical vertebrae. The next 12 belongs to the thoracic curvature. The next 5 belongs to the lumbar. And then we're going to have a 5 little fused vertebrae that belongs to the sacral curvature. And all the way at the bottom, we have what we call the coccyx. Okay? But once again, you don't need to know individual name of vertebrae. I'm not going to ask you questions about that in the exam. All right, let's take a look at the thoracic cage now. And remember, the thoracic cage is made of the sternum and the ribs. Another good news, you don't need to know individual name of ribs. Now, ribs are numbered. Go from a bottom, from superior to inferior, they are numbered, okay? But you don't need to know that. You will need to know some of the markings of a rib, which we're going to talk about in the next slide. Another bone that you need to know that is part of the thoracic cage is what we call the sternum. Now, the sternum does have some markings that I love asking questions about it in the exam. One of those markings of the sternum is what we call, excuse me, the manubrium of the sternum. Go back here. So what is the manubrium? Manubrium is this top section of the sternum right here. So manubrium is a marking of the sternum. If I was pointing to this structure here on the exam, you would simply say manubrium sternum. Then we have the body of the sternum, which is this section right here. Again, this is a marking of the sternum. And then all the way at the bottom, we have what we call the xiphoid process of the sternum, another marking of the sternum. So again, the sternum is divided into manubrium, body, and the xiphoid process. And just like any bone marking, when you give me the name of the marking, you need to tell me the name of the bone which the marking belongs to. So it's manubrium sternum, body sternum, xiphoid process sternum. Now let's take a look at the markings of the ribs that I want you guys to know for the exam. So we are looking at a rib right here, which is what we call a true rib. Why is it called a true rib? It is called a true rib because this rib is attached directly to the sternum through a piece of cartilage that we call the costal cartilage right here. Okay, so we are focusing on a true rib. And those ribs, they are going to have a head, which is attached to the vertebrae right there. Every time that you have a head of a bone, you're also going to have a neck of that bone. So right after the head, we're going to find the neck of the rib. And then the rib is going to go from posterior to anterior, and it's going to make a curve. That curve is what we call the angle of the rib. So this turn right here. Then we have the main section of the rib, which we call the body or the shaft of the rib. And then we have the point of attachment of a true rib to the sternum, which is a piece of cartilage that we call the costal cartilage of the rib. Once again, these are all markings of the rib. So when you're answering questions, it's going to be head of the rib, angle of rib, neck of rib, shaft or body of rib, costal cartilage of the rib. Okay? Any questions, folks? All right. All right, moving right along. We are done with the exoskeleton. Now we're going to talk about the appendicular skeleton, which are the bones that are attached to the exoskeleton. And we're going to start all the way in the superior aspect. We're going to take a look at what I call the pectoral girdle, also called shoulder girdle. Now, I need you to understand shoulder girdle or pectoral girdle is not the name of a bone. Okay, it is a family of bones. So on the exam, I don't want you to put down, oh, that is the right pectoral girdle or the left pectoral girdle. No, you need to be specific. There are two bones that makes up the pectoral girdle. We have the clavicle and we have the scapula. Now, very important. I need everybody's attention here. You know, here you can see I put it the collarbone and the shoulder blade just to give you an understanding where those bones are, what they are. I want you to use the scientific, the medical name for those bones, which is the clavicle and the scapula, not the collarbone, not the shoulder blade. Okay? And again, you can tell that by looking at the exam list. You're not going to find collarbone in the exam list. You're not going to find shoulder blade in the exam list. So let's take a look at these bones right here. Let's start with the clavicle. And the clavicle has some markings that you guys don't need to worry about for my class. So there's no markings that you need to know for the clavicle. But of course, we do have two clavicles, right? We have right clavicle, we have left clavicle. Taking a look now at the scapula, and of course, again, these are bilateral. We have the right scapula, we have the left scapula. And what we're looking at right here, we're looking at a posterior view of the scapula. Can anybody tell me, is this the right scapula or the left scapula that we're looking at? Again, this is a view from the back, posterior. What do you think, folks?
The right scapula?
Absolutely the right scapula, okay? And you can tell, if you didn't know, but they highlighted here, right here in the little model for you. All right, but you're not going to have a little model like that on the exam. You're going to be able to have to look at this, identify the markings that we're going to go through right now, and understand if it's the right or the left. Now, of course, I'm going to tell you if it is posterior, if it is anterior view, if it is a lateral view. But I'm not going to tell you if it is the right or the left. That's something that you need to determine for the exam. Now, there are three markings of the scapula that I want you to focus on. What are those markings? One of them is what we call the acromion of the scapula. And we can see the acromion right here. And we can also see a little bit of the acromion right here on this view, right there. So this is a marking of the scapula. If I was pointing to this structure right here on the exam, guys, how would you answer that to be correct? You would say acromion, right scapula. Acromion, right scapula. The other two markings that I want you guys to know are the coracoid process, and we can see the coracoid process right here. And there is what I call the glenoid cavity. And the glenoid cavity, guys, imagine that my hands here is the glenoid cavity. The glenoid cavity is a kind of flat surface that is covered in articular cartilage. Take a wild guess. What is going to articulate with the glenoid cavity of the scapula? In other words, what is going to be attached to the scapula right there at the glenoid cavity, guys? You are looking at it in this cartoon right here. I'll give you a little hint. What is the bone? Tell me the bone that will articulate with the scapula at the glenoid cavity. Guys, what bone is this of the upper arm?
The humerus.
The humerus. Thank you, Louise. That is the humerus. Okay, specifically, and we're going to talk about this next, it is what we call the head of the humerus that will articulate with the glenoid cavity of the scapula to form what? To form our shoulder joint. So the reason why you can move your arm in different directions here is because of what we call this ball and socket joint that we have. Can you guys still hear me? Okay. All right, so these are the three markings of the scapula that you need to know. Any questions about them, folks? Moving on. So let's take a look at the humerus now. And again, the humerus is going to have several markings that you guys need to know. Let's start from a proximal end and then move down into the distal end. And at the proximal end of the humerus, I want you guys to know the head of the humerus. And we can see the head right here. Can we see how the head, it's like nice and smooth? Why? Well, it is covered in articular cartilage because it's going to articulate with the glenoid cavity of the scapula. Okay? Now, every time that we have a head of a bone, guys, what else we're going to find? A neck. And the humerus has two necks. It has what I call the anatomical neck, and it has what I call the surgical neck. Where is the anatomical neck? The anatomical neck is right underneath the head, right here. That would be the anatomical neck. The surgical neck is all the way down below here. And it's called the surgical because when people fracture the neck of the humerus, they don't fracture the anatomical neck. They actually fracture the surgical neck right here. Another marking that I want you guys to know is what I call the greater tubercle, and we also have the lesser tubercle. What are these tubercles here? These are bumps on the humerus that serve as attachment to tendons and ligaments. How would you answer this on the exam, folks? If I was pointing to this guy right here, this is what we call the greater tubercle right humerus. If I was pointing to the head of the humerus, would say head of the right humerus. These are all markings of the humerus. Let's take a look now at the distal end. And in the distal end, we have an indentation here called the coronoid fossa, which is another marking of the humerus. And I also want you guys to know the capitulum, the trochlea, and we get back here to the capitulum and the trochlea. Both the capitulum and the trochlea, they are covered in articular cartilage. Why? Because they will articulate with the bones of our forearm at our elbow. Okay, right there. Now, in a posterior view of the same humerus, the right humerus, there's another marking that I want you guys to know, and this is what we call the olecranon fossa, right there. And then we can see the epicondyles, and there is a medial epicondyle and a lateral epicondyle. Of course, the medial epicondyle has a medial aspect. The lateral epicondyle has a lateral aspect. And these are the markings of the humerus that you need to know for the exam. Moving on to the forearm now, excuse me. And we do know that the forearm has two bones parallel to each other, right? We have the ulna and we have the radius. And we have established that the radius has a lateral aspect, while the ulna has a medial aspect. Now, let's take a look at some of the markings of the radius, the markings of the ulna you need to know for the exam. Let's start with the ulna first. A marking that you need to know is what we call the olecranon of the ulna, right here. What is this olecranon? Guys, if you bend your arm and you touch the tip of your elbow, you are touching the olecranon of your ulna right there. Okay, so we have the olecranon of the right ulna. We have the olecranon of the left ulna. Right underneath the olecranon, we're going to find the trochlear notch, which is this little region underneath it. And then we also have what we call the coronoid process of the ulna, which is this little bump right here. So this little triangular region right here is the coronoid process of the ulna. Okay, these are all markings of the ulna. Now, on the distal end, there's another marking of the ulna, which is called the ulnar styloid process, or also called the styloid process of the ulna. And then for the radius, there is this bone marking here, only one that I wanted to know for the exam. And that is what we call the radial styloid process, also called the styloid process of the radius. All right, help me out here, folks. Can anybody tell me what is the name of this marking right here? Name it to be correct in the exam. Little practice. Nobody? Nobody want to practice?
Radial styloid process of the right radius.
Thank you. That's the radial styloid process of the right radius. Okay. All right, moving on. Let's talk about the wrists and our hands. So the hands are divided into several different bones. We have the carpal bones, which are the bones of the wrist. We have the metacarpal bones, which are the bones of the palms of the hands. And we have the phalanges, which are the bones of the fingers. Let's start right here by identifying, being able to identify the right hand from the left hand. Folks, on the exam, I could not, I might not have a hand that is actually attached to the body like this. I'm going to have a hand, a picture of a model of a hand, kind of like this, okay? Which has the anterior veil, also called the palmar veil, meaning that you're looking at the palm of the hands. And you need to be able to identify this, whether it is the right or if it is the left hand. So to understand that, you have to picture, to visualize a little skeletal system standing in a standard anatomical position with the palms of the hands facing forward. Okay, and what we can see here is that we can see that the thumb right here, which would be right here, it is facing laterally. It has a lateral aspect. Okay. All right, so let's name some of these bones right here. And I have a very good news. And the good news is that you don't need to memorize the name of the carpal bones. We have a total of 8 carpal bones. You don't need to know the name of any one of the wrist bones, the carpal bones. You're welcome. Merry Christmas. Okay. Now, moving on to the metacarpals, which are the bones of the palm of the hands. How do we name them? They are numbered from 1 through 5. That's it. And the number 1 is going to be right here, is going to end at the thumb. It is not the thumb, but it's going to end at the thumb. So it would be number 1 metacarpal right hand, number 2 metacarpal right hand, number 3, number 4 metacarpal, number 5 metacarpal of the right hand. So you need to have all of that information in there. It's not just 1, number 2, or number 3. It's number 1 metacarpal, number 2 metacarpal, number 3, number 4, number 5 metacarpal. Moving on to the phalanges, and the phalanges are a little bit more complex. The phalanges are also numbered from 1 through 5, with the number 1 being right here, the thumb. So it's going to be 1, 2, 3, 4, and 5. Now, the problem is is that the phalanges are split, are divided into smaller bones. So when I'm pointing to one of these bones, you need to be specific to what bone I'm pointing to. So let's say that we are pointing to this bone right here. How would you answer that to be correct in the exam? You would say right second proximal phalanx. Because the phalanges here, they're divided into what we call proximal, middle, and distal. The only one that doesn't have a middle is the thumb right here, which is only proximal and distal. But the other four, they have proximal, middle, and distal. So this one right here would be the right second proximal phalanx. Now, phalanx is singular, phalange is plural. If you don't remember that in the exam, it's okay. I still give points even if you put in phalange. The next one right here would be the right second middle phalanx. The other one would be the right second distal phalanx. So please, let's practice together here. Help me out. Can anybody name this bone right here?
It's the right fourth middle phalanx.
Absolutely correct. That is the right fourth middle phalanx. Okay? And I see this a lot in the quiz that you're going to take today or the exams in which I'm pointing to one of these bones here. And you know what people say? You know what they do? They're going to come here and say, oh, yeah, this is the right third phalanx. Which one? There are three of them. You need to be specific. I'm going to be pointing to one of those specifically. I'm not asking for the entire finger. No, I'm asking for a specific bone within the phalanges. Is this clear, folks? Any questions? All right. Again, the good news is that this exactly same setup is going to be for the foot as well. So if you know how to name the bones of the hands, you're going to know how to name the bones of the foot as well. All right, moving on. Now we are at the pelvic girdle, also called the hip girdle. And the pelvic girdle are made of two bones. And they are what we call the hip bones. Now, as we're going to see in the next slides, the hip bones are actually made of three bones that over the process of evolution, they fuse together. They used to be what we call the ilium, the ischium, and the pubis. But again, they fuse with one another, becoming what we call the hip bone. Okay? And there are some markings of the hip bones that you guys need to know. Now, these markings that I'm going to go over with you, it doesn't belong just to the ilium, just to the ischium, or just to the pubis. No, they belong to the hip bone. So what are those markings? Some of the markings that I want you guys to know include what I call the pubic symphysis, which is a little piece of cartilage right in the middle of the two hip bones. So here we have the left hip bone and we have the right hip bone. Then we have the acetabulum right here. What is this acetabulum? The acetabulum, guys, it is a curved surface on the hip bone and is covered in articular cartilage. Take a wild guess what is going to articulate with the acetabulum. What bone will articulate with the acetabulum, guys? The femur. Absolutely. To be more specific, the head of the femur. And we're going to see this in the next slides. So the acetabulum is a marking of the hip bone. So if I was pointing to this marking right here, this would be acetabulum left hip. If I was pointing to this one right here, this would be acetabulum, right hip. Okay, it does not belong just to the pubis. It does not belong just to the ischium. It does not belong just to the ilium. It belongs to the hip. And this entire bone right here, that's a hip bone. That's the right hip bone. And here we have the left hip bone. All right. Another marking that I love asking questions about it in the exam is this big foramen right here. This is what we call the obturator foramen. Why is it called obturator? It's called the obturator because there's a nerve called the obturator nerve that will pass right through this bone and go down into our legs. All right, so we got the name from the nerve. So again, we have the obturator foramen, right, left hip, obturator foramen, right hip. And here we have another view of the hip bone. And again, we can tell here, take a closer look at the acetabulum and the obturator foramen. Can anybody tell me, this is a lateral veil, okay? A lateral veil. Can you make out if this is the right or the left? Let me give you a hint. The pubis has an anterior aspect. So the pubis has an anterior aspect.
The
Meaning
left, right.
This is
Left.
the right.
Oh,
Flip a coin, Stephanie. It is the right. That would be the right. Okay. So again, we can see here the pubis, and we can see this greater sciatic notch, which has a posterior aspect. So we are looking at the lateral right view of the hip. All right, folks, moving along, almost there. Now let's take a look at the lower limbs. And within the lower limbs, we're going to find the femur, which is, our thigh bone. Again, I don't want you guys to use thigh bone in the exam. It is the femur. And it is the heaviest and strongest bone that we have in our body. So let's take a look at some of the markings of the femur. It's starting all the way at the proximal end, and then we're going to go towards the distal end. And in the proximal end, we have the head of the femur, this round surface right there that is smooth and covered in articular cartilage. Why? Because it will articulate with the acetabulum of the hip. And remember, every time that we have a head of a bone, what else we're going to find? A neck. So I want you guys to know the neck of the femur. And here is where we're going to find the neck of the femur. And then there's going to be two trochanters, a greater trochanter and a lesser trochanter, which are these little bumps right here. And we can see that the greater trochanter has a lateral aspect, while the lesser trochanter has a medial aspect. And these are points of attachments, again, to ligaments and tendons. Okay? These are markings of the femur. On the distal end, I want you guys to know the two condyles. We have a medial condyle and we have a lateral condyle. And both of them are covered in articular cartilage because they will articulate with the tibia forming our knee joint. So it is the medial condyle right femur. It is the lateral condyle right femur. Moving on, let's take a look at the knee joint and the patella right here. Can anybody tell me this is an anterior veil? Are we looking at the right patella or the left patella? Again, anterior veil.
Right patella.
This is the right patella, absolutely. And the reason, one way we can find out is just take a look at the fibula and the tibia. The tibia has a medial aspect. The fibula has a lateral aspect. Okay, if I was pointing to this guy right here on the exam, this would be the right patella. Moving on now into the lower leg, we have two different bones parallel to each other. We have the tibia and we have the fibula. Let's start with the tibia. And folks, at our knee joint, only the tibia will articulate with the femur. There is no articulation of the fibula. The function of the fibula is just to stabilize us laterally. That is the job of the fibula, because it is not part of the knee joint. Okay? And the femur will articulate with the tibia at a surface that we call the medial condyle and the lateral condyle of the tibia. This is why when you give him the name of a bone marking, you don't just say the bone marking, because as we can see here, we have a lateral and a medial condyle both for the femur and the tibia. So I need to know if this is the medial condyle of the femur or is it the medial condyle of the tibia? Is it the lateral condyle of the femur or is it the lateral condyle of the tibia? Okay. Now on the distal end, we're going to find the medial malleolus of the tibia and the lateral malleolus of the fibula. And guys, if you touch your ankle right now and you can see those two big bones on the side of your ankle, you are touching the malleolus, the medial malleolus of the tibia and the lateral malleolus of the fibula. And those malleolus, those markings right here, they will articulate with your bone of the ankle. And that bone is what we call the talus, right here. We can see how the talus has a smooth surface because it is covered in articular cartilage and will articulate with the medial and the lateral malleolus of the tibia and the fibula. All right, forming our ankle joint. So the foot is divided into tarsals, metatarsals, and the phalanges. For the tarsals, there are two tarsals that I want you guys to know only. And those are the talus and the calcaneus. You don't need to know all the other ones. Okay, but again, I do want you to know by name the talus and the calcaneus, being able to identify them, name them. Now, taking a look at the bones of the sole of our feet, and they are again numbered, just like the bones of the palms of our hands, but we're going to call them the metatarsals. The hands are the metacarpals. The sole of our feet is called the metatarsals, and they are numbered 1 through 5. So if I was pointing to this guy right here on the quiz or the exam, this would be the number 2 or the second right metatarsal. Okay. Now the phalanges, which are the bones of our toes, they have exactly the same arrangement as the phalanges of the fingers. They are divided into proximal, middle, and distal from 2 to 5, and proximal and distal for the number 1, which is our big toe right here. Okay. But again, the other ones we have proximal, middle, and distal, and they are numbered 1 through 5, with the number 1 being the big toe. Any questions, guys? Anything at all? Of course not. All right. So folks, that's it. So we just went through half of the exam together. What are we going to do for the in-lab activities for today? As I mentioned, there's no in-lab activity for lab 4. All 3 activities belong to lab 5, but they're going to count for both lab 4 and lab 5. What are they? These are very useful, very important videos. We're going to have a video that's going to walk you through the bones of the exoskeleton. We're going to have a video that's going to walk you through the bones of the appendicular skeleton. And we're going to have a video that's going to walk you through some of the important bone markings that we have within our skeletal system. Okay, and this is something that you can watch today and then rewatch it again later on as you are preparing and studying for the exams. Because in the videos, they use human models, which is the same type of models that I'm going to be using for my exam. I have pictures of models. They are not pictures of cartoons. They are pictures of models. And you need to familiarize yourself with those models. Okay? After you're done with the in-lab activities, again, there are 3 of them, then you need to jump on Lamaku and take the quizzes for today. And there are 2 quizzes open for lab 4 and lab 5. And after you're done with the quizzes, you're good to go. Let's get started.